I'm Tom. I'm a student physical therapist at Regis University. We're going to be checking the active range of motion to the mid-cervical spine. Zach, if you could go ahead and bring your left ear to your left shoulder for me. Any symptoms with that?
Oh, that feels okay.
I'm going to add a little bit of pressure. Does that feel all right?
Yep, still feels fine.
Good. We'll go ahead and go to the other side. All the way down as far as you can. Watching, make sure the shoulders aren't coming up. Any symptoms with that?
Nope, feels fine.
Great. How's that feel?
That feels okay too.
Terrific. And go ahead and relax. Next, we're going to have you go ahead and look all the way to your right for me. Do you have any symptoms with that?
Nope, feels fine.
I'm going to add a little bit of overpressure. Let me know if that's uncomfortable at all.
Nope, that's good.
And back to the other side. How's that feel?
Feels good.
Terrific.
Yep,
Still
same
feel
thing,
right?
still feels fine. Yep.
Terrific. Then if we could have you go ahead and swing and face the other way for me. And I want you to go ahead and bring your chin all the way down to your chest. Does that feel okay?
Mm-hmm.
All right, add a little bit of pressure. How was that?
Good.
Good. And then look all the way back for me. And then we'll add a little bit of pressure. Does that feel okay?
Yep.
Terrific. And relax. And now we're going to measure active range of motion in the mid and lower cervical spine. So we're going to go between C7 and T1. Go ahead and flex forward for me real quick. Perfect. And relax. All right. Zero that. Go ahead and bring your left ear to your left shoulder. As far as you can. And we'll hold and save that. All right. And relax. And then we're going to go completely to the other direction. Making sure these are stable as far as you can. And relax. Terrific. Now if I could have you go ahead and face that way. And we're going to check flexion and extension. Again, same placement. Make sure that they're stable on the patient. And Zach, if I could have you go ahead and bring your chin all the way down to your chest for me. As far as you can. Terrific. And then go ahead and relax. And now I want you to look as high to the ceiling as you can. Alright, perfect. And now if I could have you turn to your right, we're going to use a goniometer. And we're going to check your active rotation. So line this up. And I want you to go ahead and bring your head, look to the right as far as you can. Have any more?
Mm.
All right, and back to center. And then to the left. And relax. Now we're going to assess some of the passive range of motion of mid and lower cervical. So we're going to bring him all the way into flexion. Extension. Perfect. Relax. Then we're going to check lateral flexion. As far as you can go. Good. And then rotation. And then we'll go ahead and use an inclinometer to evaluate the amount of cervical rotation that Zach has here. You can go ahead and bring your head all the way to the right for me. Good. And then let me reset it. I want you to go ahead and bring it all the way to the left for me. Good. Lastly, we're going to be checking for his passive accessory vertebral motion. Ideally, I'd be in a high-low table in a staggered stance, but we're kind of making do right now. Use my abdomen to keep him nice and flexed. And we're going to be checking the facet joints as they down glide from C2 all the way down to C7 and T1.